To kick us off, our first panel is titled Health Increasing Access and Life Expectancy. Please welcome our panelists as they take their seats. We are thrilled to have Dr. Pierre R. Theodore, the Executive Director and Therapeutic Area Leader in Population Sciences at Roche Genentech. His 20-plus years of experience has resulted in significant contributions to clinical education and medical research. Also providing her voice and experience, please welcome Helen Torres, who has 25 years of service as the CEO of Hispanas Organized for Political Equality, also known as HOPE. Next, we are proud to include the discussion, the President and Chief Executive Officer of Charles R. Drew University of Medicine and Science, Dr. David Carlisle, and USC Vice Dean for Student Success, a teaching professor for USC Sol Price School of Public Policy, Dr. LaVonna Blair-Lewis. Leading this conversation as our moderator is Dominique DiPrima. Dominique is a podcast and talk radio host on KBLA Talk 1580, which is the first Los Angeles Black-owned talk radio station. She's also an artist, an activist, and health advocate. Let's give our first panel a hand.
Thank you, Melissa. I am just honored to be here with all of you and with this incredible panel. What could be more important right now than health and access and longevity, especially given what we're currently facing? So I'm looking forward to hearing from each one of our panelists. And I want to put the frame out there, as Dr. Theodore challenged me to do earlier, that really I would love for all of us in this room, because I know there are people from so many different walks of life and so many power players in this room, that all of us take a moment to think about what is our role? What can we do to improve access and to improve the outcomes when it comes to longevity as we look at the state of Black Los Angeles? I want to start with you, Dr. Theodore, since you went there with me, and also because one of the things you did in your work at Yale University was focusing on health equity. And so when we talk about equity, we heard Dr. Scorza, we heard Supervisor Mitchell framing this in terms of this cycle of harm. And I'm thinking about the big bill, for example. As we have less resources, perhaps we don't have Medi-Cal, perhaps we have defunding of programs that support clinics and programs that have allowed access for the less resourced communities. How does that impact the actual medical piece, the actual health care piece, when we talk about longevity?
Thanks, Dominic. Looks like I'm having a little bit of mic trouble here. There you go. Thanks very much for that. I want to just start off by offering my gratitude for all of you that are assembled here today, and in particular to the LA Urban League and University of Southern California and all the participants for engaging. And I think it's a critical way to start the conversation, which is how do these kind of structural challenges ultimately manifest in how we take care of patients and their outcomes and their well-being. You know, I have the pleasure of working at Genentech, which is a pharmaceutical company where we translate science into medicines. And before that, however, I practiced medicine for many years in East Baltimore in the Johns Hopkins Hospital, and it could not be more obvious to me day in and day out. Thank you. Could not be more obvious to me day in and day out that there are some struggles that our community in particular face as a result of some of the structural challenges that you just pointed out. And the issue to recognize is that these issues are long-lasting, they are persistent. It is not a matter of a current political environment. While it does worsen, these issues are likely to remain for a significant amount of time. So it comes up to us, for example, in our industry, to think about issues of access. What are the barriers that patients face? The cost of medications, racism that experienced in the healthcare system, finding the right partnerships that can engage with us to reach patients. And so we are committed to finding solutions and finding partners that can help us to address some of the disparities that you just pointed out.
And of course, our theme is Solidarity in Action, Black and Brown LA. And when we talk about access, we also have to look at job outcomes, right? We see among this data and the national data that Black women are losing their jobs, 300,000, I believe, since January. And we see the attacks on many in the Latino community based on the ICE raids, which of course has a huge economic impact on any family. And so when you lose your job, many times you lose your health care with it. Or if you don't have health care, you lose the ability to pay for it out of your pocket. And so in what ways can we support one another when we talk about solidarity in this economic piece where it's not just losing a job, it's losing access to care for your family?
Is that directed?
Yeah, that's addressed to you, Helen Iris Torres.
Well, let me also start with a moment of gratitude. First, it's a privilege to be in this room with individuals that I know every day are fighting for justice. So thank you so much for including myself as the CEO of Hope Hispanas Organized for Political Equality. I do want to give out a special shout out to Susanna Sandoval Young, who is on your board at the Urban League and made sure that we were a part of this conversation. Just appreciate her leadership. To answer the question, I want to ground it with some of the research that Hope has been doing. We have entered in the 4th year of a 5-year partnership with Black Women Organized for Political Action, BWOPA, in conducting with Kaiser support 3 key studies on Black women and Latinas in California and their experience with the healthcare system. We are wrapping up our 3rd study that speaks to your question around healthcare access, especially around healthcare professionals. But I want to focus on the first 2 that we completed, which was on mental health as well as maternal health. And the things that we have in common is the accessibility of costs is a burden for both our communities. The lack of physicians that understand our culture, understand our language, understand who we are when we show up in hospitals or in our doctors' offices is also a major barrier. And the last one, from a gender lens, for women in particular, obviously, what we're experiencing is a complete denial of our experiences. So when we go to the doctor, oftentimes they don't believe us. What does that result in? When it comes to healthcare access, we know that the majority of Latinas and African American women, they don't have access not because they're not working. In fact, that was what the Affordable Care Act was trying to solve for, right? Where we were working but in jobs that did not provide health care insurance. The Affordable Care Act and our public health system is really important to ensure that even if you're working and can't afford it, we will have good quality health care. We're not quite there yet. Unfortunately, because of the rollbacks that are happening, we're not going to get there anytime soon unless we organize and ensure that 1, we have access to good jobs, and that 2, that we continue to have good access to health care. Combined, we can do this together. We have the similar problems when it comes to the healthcare system that is not delivering for our community.
Yep, and it's well said, and I guess that's why our government is shut down as they argue over whether or not those Affordable Care Act subsidies will continue to be available for working class and middle class families to be able to afford that access. Dr. Carlisle, we were talking off the microphone about the impact of COVID-19 on life expectancy and how that hit particularly hard in the African American community. We already have historically had shorter life expectancy than other communities. It is bouncing back, is it not? How can we keep that bounce back going in the current environment?
Well, to be sure, the COVID-19 pandemic was probably the most devastating singular event affecting the health of African Americans, especially in California, in decades. And we're still reeling from that effect. Everybody that I know knows somebody or knew somebody who passed away during the COVID-19 pandemic. That's a profound statement. The African American community, as you point out, was disproportionately impacted because of where we are, the work that we do, our health in general, things like this. And the disparities in life expectancy, to be sure, they're bouncing back. They still exist. And this is a major issue here in Los Angeles. I note, we're here on the USC campus. My dad came to Los Angeles, was born here in 1927. My grandmother came here in 1918. In this community, when you look around us, you see the major issue with access to health care. Because there used to be doctors around here. There used to be doctors over in Stalker, on Crenshaw. They're not there anymore. And as much as the Affordable Care Act has given us a ticket for health care, the ability to exchange that ticket for services has become a major problem. One of the results has been the issue that arose during the COVID-19 pandemic, when we were devastated by that pandemic.
When we look at this data from the county, one of the things we see is that the number of African Americans who report having a usual source for health care has declined from year one, to year two. That we see we've gone from 17.2 to 11%, I believe. And so that to me is key, because it's the preventative care, I would imagine, and that consistent access that allows us to have better health outcomes in the long run. Dr. LaVonna Blair-Lewis, you talk a lot about cultural competency in your work and access. How do we solve for that?
So I want to start, again, thanking everyone for being on the campus. I've had many events in this space in my 30 years here, but I will say that this is the first time my Blackness has been centered in this space. So I thank you for that. So I think fundamentally it really is about meeting people where they are, right? We can have grand plans and grand designs that mean absolutely nothing to people on the ground because no one checked in to find out what really mattered to people. And so when we start talking about, programs and practices that are designed to bring more people in, again, it's like, what type of invitation is being given? So for example, when I first got to Los Angeles and we were just looking at the information that people were getting about their choices, the grade level of the reading was the second-year graduate student reading. That was the level. Make a decision. If you got an 8th grade education, how do you do that? And so just making sure that people have information in a way that is meaningful for them, I think is the first step. I also think it's important to believe what people are telling us, right? Over and over again, people are saying, this is a problem for me, and they're getting gaslit. It's not true. People are telling you what's happening, and sometimes people aren't listening. That's why we have trust issues. I'm telling you what's going on for me and my family. I'm telling you I'm trying everything that you've said. It's just harder here. And if I live in South LA, and South LA is different from West LA, and when you tell providers that, sometimes they don't believe that. People want to make healthy choices. Someone needs to acknowledge that healthy choices are harder some places than others. Instead of blaming people for the choices that they're making, understand the choice sets that are available. I think that's how you make the connection. Make it meaningful. If it's 3 degrees removed from where I am, nice try, more work needs to be done.
So you're saying they don't believe you? They don't believe you, Blair Lewis? When you tell them what's happening, they don't believe you? It's different between South LA and elsewhere?
The data shows it's different. But again, it's like if you've always spent your life in West LA, it never occurs to you that it's different someplace. That's why the science matters. You have to show people this is true. It's not a figment of someone's imagination. That's why I say believe people when they explain to you their reality. It may not be yours, but if it's theirs, that's where you start.
Yeah, well said. Another data point that we have, which is a bright spot but still not wonderful, is that from year 1 to year 2, Black residents saw the largest decline in the percentage of adults who ever seriously thought about committing suicide. It went down from 7.9 to 11%. That's really a pretty notable decline. And I want to circle back. I don't have data in front of me for the Latino community, but Helen Iris-Torres, you just said you completed a study around mental health and access. And I'm wondering how we can keep that trend line going down and what part we all have to play in that.
Yeah. So let me ground the study a bit. We did the study a year after COVID. And our concern was the isolation of Black women and Latinas. during the COVID pandemic. What we heard overwhelmingly was they didn't feel, one, they couldn't understand how to access for a mental health provider. So the system was already failing them even before they got into the system because it was so difficult, especially if you're in public assistance, to get a mental health care provider. The second time, the second barrier was once they actually got an appointment, it was usually with an individual that did not believe them, did not believe the crisis they were going through. In fact, close to 64% of Black women and Latinas reported that they weren't heard when they went to their appointment. The third, it also builds on trust, was as they were experiencing going through a mental health crisis, they felt that they didn't have, one, their culture backing them up and believing, our families believing what they were going through. But they also felt a failure or a mistrust that if they share too much information, can I share that I'm undocumented? Can I share that I'm in public assistance? Can I share that I'm going through a divorce? Is this going to be held against me? Is somehow my data going to be shared? So that mistrust is something that we find that is common both in our Latino community and our Black community. And unfortunately, how the direction of healthcare under this new administration is going, where a lot of data sets are being shared, I don't see there's a solution for that mistrust at the current rate of how we're sharing data. And that's, I believe, would be a major concern.
Yeah, that's a big hurdle to overcome. I'm skipping over to some of the economic data because I believe that they are connected, and I don't think you have to be a rocket scientist to see that. When President Barack Obama took up the Affordable Care Act, a lot of people didn't look at it as an economic factor, but we know that Black families are getting bankrupted, American families are getting bankrupted by health care bills, et cetera. So I'm looking at this between the first and second year report. Black homelessness increased from 19,522 to 22,606. And I know, Dr. David Carlisle, that one of the things you've worked on a lot is access for people who have zero access. We saw it in COVID when people were coming from West LA to try to get shots over here in South LA because they were readily available. Now we have new guidance about COVID shots, and I wonder about any kind of future emergency of this nature. How would we be able to provide the same kind of care for the indigent that you were able to do during 2020?
Well, this is a big question and a complex question. But if we're talking about the social determinants of health, and this is social determinants, I want to reflect on the role of the LA Urban League in bridging some of these gaps, because for decades, the Urban League has contributed to improving the social economic status of Black Angelenos and Brown Angelenos. This has been a major role of the LA Urban League, and I just want to recognize that role, because things would be different in this area without the LA Urban League, for sure. So thank you very much. You know, when I think about healthcare, the best thing that you can do is prevent a condition before it develops. That is the role of vaccines. And without vaccines, things would have been very different during the COVID-19 pandemic. I shudder to think about how they might be different. I have to say, recognizing the great work that went into developing these vaccines, we would be in a different place without them. I want to salute people who worked on them, including the African-American scientists at the NIH, who was part of that effort. We're very fortunate that we had the mRNA technology developed, or was sitting kind of on the bench waiting for something to focus on. That allowed us to fast track COVID-19 development. So we're really talking about the intersection between science, public health, and public policy. And I'm worried that we're losing that focus on that intersection as we go forward today.
So, I mean, what does that mean? I know at KBLA Talk 1580, we have the
earthquake drill.
drill. We have
Hear this message.
the advantage of being able to talk directly to our community, sometimes Siri and the phones just, they have no manners. But we have the opportunity to talk directly to our community at KBLA 1580, and I know you do that. Most of y'all do that in your work. But how do we kind of circumvent this lack of trust, which I feel like it's going to grow? I mean, I could go into all the reasons why, but we'll save that for my radio show.
Dominique, maybe I can jump in here in that I think you're touching on an important issue that's kind of thematic, this idea of trust and trustworthiness, is that the sources of information that patients and individuals use to govern their decisions have become less and less reliable over time.
Right.
So traditionally we would turn to the CDC or the FDA, we would turn to very important organizations to help guide us, but that communication is broken down a little bit. And so therefore people often turn to more, let's call them pop sources of information, which can really impair kind of a clear thinking in how to engage with the healthcare system. So one of the issues that we're facing right now is a challenge of clear information that reaches patients when they need it in a way that's actionable.
Especially when those pop sources are the Secretary of Health and Human Services. I'm just saying.
I just wanted to add that I think that the role, speaking of the issue of trust, I mean, there are a lot of systems that use patient navigators, or promotoras, or community health workers, and these are people who are from the community, who have a different level of credibility than someone that's there part-time. And so I think the important issue is to recognize who are the trusted voices in the community, and how do we get those voices the right information, accurate information, because they can become disseminators of information in ways that we may never be able to. And so it really is recognizing the existing resources, recognizing that expertise comes in many fashions. There's the academic expertise, and there is the on-the-ground expertise and knowledge of what's happening on the ground. Yeah. And those things have to come together for people to really kind of advance in the way that we think is important, particularly when there's so much attacks and trauma that are happening right now.
So, I mean, what you're talking about goes to cultural competency. I don't know if that's where you were going.
I was. Both of our studies on mental health and maternal health, the doulas, the promotoras in our community are the most trusted when we did the survey. The third was nurses. So these are individuals that are closest to the patient and to patient experience. No offense to the incredible doctors that we have on the stage, because I trust you guys already. But it also was a woman's voice speaking to a woman's issue and being heard. That when we did our focus groups, that was so important. So the combination of having the expertise, having a system in which already comes hopefully built with trust of the patient in the patient experience. But for women, to be there for women, that was an incredible finding of our study. Regardless of Latina or Black women, being able to be in community was part of the solution.
I mean, that makes sense. There's some things I'm not going to say to a man, period. Sorry, Doc. I'm just not going to reveal certain things about certain things. And so that absolutely makes sense.
Dominique, if I may also.
Dr. Carlisle, of course.
I wanted to add on to our discussion. There's a survey African-American research organization called Veritas here in Los Angeles.
Yes.
They just did a study called Listening to Black Californians, asking African-Americans what they think about the healthcare system in our state. And the results were somber. Basically, if you are a person of color and you're getting ready to access the healthcare system, you have to put on a suit of armor. You have to wonder if, to your point, what I say is going to matter, or is the answer already there in this person's mind? As a healthcare provider, that is disturbing because it means that patients do not trust the healthcare system. And of course, we know that if you are a person of color, you have a good reason not to trust the healthcare system. This is a problem that needs to be fixed. And I think we're moving in the wrong direction today.
I mean, I feel like we always hear the example of Tuskegee We always hear the example of the experiments. We always hear these old examples. But in reality, many people don't even know anything about that, and they're going based on their experience today. To your point, Dr. Lewis, about how people just don't listen. So I'd throw this out to all of you. How do we overcome that and build that trust? I don't think the answer is talk about, the Tuskegee experiment. I think the answer is something grounded in today.
Yeah, I mean, I think just for me, I personally think that my gift to the universe is asking questions and listening to the response, right? Because that takes work on both parts. Asking people what matters most to you right now, and let's use that as the starting point. Because all those other things that I think may be important are absolutely meaningless, because you're thinking about groceries, you're thinking about your kids, and I'm trying to get you to sign up for this program. It's making it meaningful. And you don't do that by accident. You do that intentionally. You do that by connecting to people what matters to them, right? And that takes, like I said, you have to listen, right? You have to listen and then follow through. Accountability, I realized very recent, maybe it's not so recent. I realized that people want accountability for others, but not themselves. And that's the problem. That's the problem. It's like, okay, if we don't all see ourselves as part of the problem and the solution, nothing changes. Because I'm always able to kick the can down to somebody else, not my time, not my generation, not my problem. And so I think that's the issue. I can't do everything, but I refuse to not do that which I know I can do. I think that's what people need to understand. I'm not asking you to solve the universe problem. I'm asking, can you get groceries over there? Can you do that?
Yeah, and there's an intimidation factor, I would venture to say. Dr. Theodore, you're a cardiothoracic surgeon. If you have on the white coat and you're telling me X, I might not feel comfortable telling you Y. How do we bridge that gap?
Yeah, no, I think it's, you're actually pointing out something important, which is that each interaction with a patient, each interaction with an individual is an opportunity to build the trust. And Helen and I were talking earlier that it takes, if not generations to build trust, but you can break it quite quickly.
Yeah.
And so I think the most important perspective that I can bring is to seek to understand before you're understood. So as a clinician in particular, to make sure I'm really listening closely to the voice of that patient, and to recognize that that patient does not exist in an isolated framework. That patient is a part of a family, of a community, of a culture, and to understand the decisions that that person makes is contextualized, not just as a little individual one person, but with their sister, with the people in their community, the voices that they hear. The more that clinicians are able to tap into that multi-level kind of essence of what a person is, the better that they can make a collaborative decision between a physician and the patient.
I also want to join you and Dr. Carlisle in thanking the LA Urban League for the work that they've done, just evidenced by the fact that this room is full.
Right.
We're streaming, we're being podcast and broadcast. That means people are listening. And that's so important. So thank you for that. And thank you, to Artie and LA County for putting this data together. I want to bring up two elephants in the room and see who wants to take them on. One is that I'm looking out at this incredible multicultural, varied age and gender crowd that we have in this room. It's packed. But I would venture to guess that we don't have anybody unhoused in here. And probably the number of working class or low resource people is low, because most of them have to be at work, right? So here's my number one elephant in the room is, are we, Black professionals, Latino professionals, the so-called talented 10th, the ones that are movers and shakers, are we doing what we're supposed to be doing? Or are we just like, I got mine, I'm cool, walking by the guy in the tent? Because I feel like at this moment in our history, with this administration that we have, those of us, and I include myself, that are doing all right, have more responsibility than at other times. And I'll start with you, Dr. Carlisle.
Well, thank you.
Anyone else
I'll take on that elephant, Dominique.
Yeah.
Thank you very much.
I mean, we have to do the elephants, right? We can't ignore the elephants in the room.
It is indeed a big elephant in healthcare, and it really drives home the need to focus on taking care of patients before they get sick, focusing on social determinants of healthcare. Because when somebody comes into an emergency room, it's their trajectory is kind of already set. You want to keep them out of that emergency room. Being unhoused is probably the biggest negative contributor to life expectancy out there. The delta in life expectancy for the unhoused community is something like 15 years. That is huge. This is a big social problem. At our institution, Charles R. Drew University of Medicine and Science, we know that there are students out there who are unhoused. We spend a lot of time looking for them. We have solutions for them. At community colleges, many students are living in their cars. Right. In our CSU system, many students are unhoused. Even the University of California has unhoused students. This is a big social problem, and it contributes directly to adverse healthcare outcomes.
I will thank you
Ms. Torres.
for that. Let me take a bite out of that elephant as well. Hope is made up of, now we have leadership programs that start at high school, college, mid-career, and at the executive level. Our mid-career program is known as the Hope Leadership Institute. I see some of the alum here. And 10% of them are now in local office. 7% of them serve in the California State Senate. We'll have our first Latina California pro tem ever elected by her colleagues, and she's a Hope alum. I say this because I know these women well, and they very much share a similar story as mine. My mother immigrated to Detroit, Michigan, from the beautiful island of Puerto Rico, also known as Bad Bunny Land. And she came for one core reason: healthcare. I was born with a pretty serious health disease, and because of the public health system, she was able to get me my first open heart surgery at the age of 12. I share that experience because we may have arrived, but I haven't forgotten where I come from. And the women that were training to demystify government and to be part of government and to be leaders, they haven't forgotten where they come from. And it's upon us all that have had success to ensure that that success is met with responsibility. That responsibility is to vote, and to vote your conscience and vote your roots, and to vote to access health care for so many. At Hope, we have three key areas: education, healthcare, and economic empowerment. It's no mistake that a Latina that was raised by a single mother on a public health and public health assistance is advocating to ensure that that continues to be strong and serves our community even stronger.
Of course, yes, Dr. Lewis.
So I have to talk about the elephant in the room, because that's how I start my social justice class. What's the elephant in the room? What are we going to talk about today? But I also have to talk about it because when I told my dad that I was going to get my PhD, the one thing he said to me was, "Don't become an educated fool." I never asked him what that meant, so I came up with my own definition. It means that you don't forget where you came from. It means that you don't think that you're better than somebody else because you have an education. It doesn't mean that you don't. It means that you don't keep bringing other people into the space, right? And that's the issue. I cannot forget my history. It shows up every day that I show up. And that's the transparency, the authenticity that is needed to make the kind of connections that can be transformative. There's an organization in Chicago, it's called Justice Informed. And the young man director Xavier Ramey, he said that we need the energy of the young people and the wisdom of the elders. Because all too often what happens is that when we get into the office where we're the only one, we like, this is really a nice office. And I'm not going to do anything to get out of it. And so we need to be reminded, you've got to keep pushing because you're getting ready for the next folks to come through. So the work that I'm doing right now, I'm doing it for 2 generations of my family not yet born. Right. Because if I stand right here, it's just too overwhelming. And so the future focus is critical. I work with youth programs. I do pipeline programs, pathway programs, because it's hard for somebody to be what they never see. And so some people don't see themselves at USC, so we have pathway and pipeline programs to put them in the space. So maybe I'm thinking differently about it.
Mm. And of course, Dr. Theodore, we can't leave you out of the elephant in the room.
Yeah, no, that's an easy one to follow, right? But what I would say is that, look, I'm coming at this in large part from the pharmaceutical sector, which doesn't always have the best reputation in the world. Let's just be honest, right, with that. But one of the things that we can commit to is that no one gets left behind when we develop new products that we wish to bring to communities. That means they're included in the entire process, from what we invest in, to the products that we develop, to the experiments that we do and the research that we do to eventually get those medicines to reach the patients that need them. So the one commitment you can anticipate from our organization is that we don't leave patients behind when we develop new products. So that's our particular contribution.
Okay, it's a big room. We got space for 2 elephants. So here comes the second one. Our theme is solidarity in action, Black and Brown LA. And while in real life, Black and Brown people, Latino people, and African Americans work, play, live, commute side by side. I mean, that's the reality of LA if you actually live here and don't just hear about it on TV, national TV. So here's the question, though. I think many times we are also in competition, and there is a real undercurrent of us or them that I feel like we have to address. We can't just skip along and pretend it ain't there. And I hear it probably more than anyone, because I talk to Black people. I've been talking to Black people on the radio almost every day for the last 30 years, okay? And I hear the complaints. And sometimes people think, you're a little too coalition-minded, Dominique. Well, I was on the board of the Community Coalition, surprise. But I think there are real issues there. And I think if we just pretend they're not there, that doesn't increase solidarity. So let's talk about it. Oh, you know, Latinos are taking up all the space in schools and hospitals, and they're taking all the jobs. Oh, Black people do not respect Latinos. They exploit us, they rob us, these are the conversations. Oh, we can't get a job because of the nepotism in the Latino community or in the Black community. So how do we address these issues? Because I think in this moment, when we're talking about longevity and when we're talking about access, if we don't find a way to be synergistic and intentional in working together, it's not going to end well. And so I just want to get the perspective, and I want to start with Dr. Lewis, because you're very outspoken, and let's start there.
So I think that I would start with the idea that they want us to lose, period. And they want us to lose to such a degree that they will do anything that they can to divide us and to say that you cannot move forward so long as they're there. Because so long as I'm worried about the 10% that we might get, the 90% goes free. And so I'm going to point people to the 90%. That's our problem over there. We lose. It's like they want us at odds with one another, because so long as we're challenging one another, we're not dealing with the elephant in the room, right? The fact that it is a systematic attack on people of color to erase their standing, to erase their contributions, to erase their value. And if you don't see that, you're not paying attention. And so that's why it's like, why are they working so hard to make us disappear? They can't handle our excellence. They can't handle our contribution. And so let's lift one another up and really freak them out. I think that's what you have to do. I mean, we have to communicate to one another. It's like, look, we both lose. We both lose. There's no other way to say it. So long as we're fighting one another, they win.
And the they is the people that don't want justice?
The privileged people. And that's a big category. But I just want to make it sure, make my definition of privilege clear. It's not about the money in the bank. It's about what you don't have to worry about. If you're always in the front of the line, it never occurs to you that there's a problem going on behind you. And so we have to keep reminding people, it's like they want us back here. Why? Because everything that we've done has been innovative, creative. They've tried to take it away from us. They've taken land. I'm going to stop.
I mean, I like to remind us that there wouldn't be a mayor, Antonio Villaraigosa, if it wasn't for Black and Brown solidarity. There wouldn't be a mayor, Karen Bass, if it wasn't for Black and Brown solidarity. And the list, there probably wouldn't be a President Barack Obama. That's right. And the list goes on and on and on. And why we forget that, I do not know. Dr. Carlisle?
Well, taking that head on, I'll just say there wouldn't even be a Los Angeles if there wasn't for Black and Brown solidarity. I think it was 1781, we were talking about dates, I hope I have that correctly, when the Pobladores founded this city. Half of them were Mexicans of African descent, and half of them were Mexicans of indigenous descent. This is a Black and brown city at its heart, and that inspiration continues today. Fast forward to the 21st century, our institution is the only historically Black higher education institution that is also an Hispanic serving institution. There's another community college, to be sure, in San Antonio, where that's true, but out of 100 HBCUs, only one is Hispanic serving, and that's Charles R. Drew University. I tell our students, when you're in the emergency room, you have to take care of whoever comes into the door on a gurney or crawling in. And that person is just as likely to be Latino as they are African American. You have to take care of all communities if you are a Charles R. Drew University student or graduate.
Well said. Helen Iris Torres.
Yeah, so I'll take it from this perspective. At Hope, we role model what we want to see in our community. I mentioned the partnership with Black Women Organized for Political Action, BWAPA, and you mentioned Avirtus. That's our researcher. And so we went with a Black woman-led firm who also was contracting with a Latina professor in our research to ensure it was grounded in both our culture and our history and our experience. That's what I mean by modeling. Everything that we do at Hope is through the lens of not only, obviously, a woman's lens or a Latina lens, but a leader's lens. And what do we want to see in the world? And how do we replicate that? And I know what we want to see is an opportunity for everyone and not have this conversation about how small the pie is, but how do we grow the pie? I love what you said about innovation. I think there's so much opportunity when we come together and we share our experiences that we can be innovative and that we're growing the pie together. I think it's also very critically important that we speak to our young children and to our children and to our high school students about this and do it together to really show how Black and brown community can come together, because they're looking, they're listening, and oftentimes what they're looking at is social media that does not depict that, or individuals that do not speak to a unified narrative. And I think we need to combat that by being good role models.
Yep, I think your partnership is also an example. One complaint we always hear is, we show up for Latinos, but they don't show up for us. And it sounds like the work that you're doing is a refutation of that talking point. We're almost into our Q&A section. So Dr. Pierre Theodore, you're going to have the last word here.
I'm going to keep this really short. It's a story I virtually never share. My career actually started here at the University of Southern California. I was a fellow in transplantation here. One of the first patients that I ever saw who donated organs was an Asian donor and donated organs, and the recipients, the left lung went to an African-American recipient, the right lung went to a Caucasian recipient. And there was an insight early in my career of this kind of commonality of the experience of disease, the commonality of the experience of health. And so as I've moved through my career progressively over the last 25 or 30 years and into Genentech as well, we take very seriously this idea that these are commonly held challenges, that this notion of the us versus them is readily to be overcome. Because at the end of the day, at some point, most of us, almost all of us, are going to encounter a major medical challenge, and we want to make sure that the products that we develop are there and are available to all.
Yep. Well said. And I think to your point about social media, the way that Black folks are showing up for Bad Bunny is, is a whole vibe. It's really a whole vibe. So I want to, thank our panel. You guys are incredible. I wasn't kidding when I said I need each one of you guys on my radio show very soon. And we're going to go and take a few minutes here to have some audience questions with our incredible host for today, Melissa McGee.
Dominique, thank you. Thank you so much. I just want to draw your attention to the center of the room. Thank you, Dominique, and thank you, panelists. You guys stay put. We do have a question from one of our viewers, and throughout the show and throughout the program, during our conversations, we're going to hear from students here in Los Angeles. We've got Khalil Smith. Come on closer, Khalil. Stand right next to me. He's with Dorsey High. He goes to Dorsey High. And Khalil, woo, woo. Dorsey in the house. Tell us what your question is for the panelists.
Okay. So my question is, what role do you think students and emerging professionals can play in breaking down barriers that keep undeserved communities from getting the rightful access to health care that they deserve?
And I think we have time for all the panelists, Dominique, to
Okay,
answer
I want to
questions.
start with Dr. David Carlisle since he's the one with the medical school.
Well, I will speak to that from a different perspective, though. I spent 11 years up in state government in Sacramento, and I can tell you that the most impactful organizations when it comes to influencing state government are organizations comprised of students and young people. It helps, of course, if they wear white coats, to be sure, but high school students, college students, politicians sit up and listen when students are talking and asking for things because they're future voters. So I would say that you already have the power to make change. And if you have a target or a goal, organize to achieve it and get on the plane, get on the bus and head up to Sacramento, head downtown to our LA County Hall of Administration, our City Hall, and make it happen because our government will listen to young people.
Helen Iris Torres, you also do a lot of work in moving young people into the pipeline of influence.
So one of the key things that we do at our high school program is they're juniors going into their senior year, and they do a survey of seniors about their experience, including access to health care. And they put together their recommendations. They do a presentation in front of the school board, but they go up to Sacramento with their own policy recommendations. What we've seen is when young voices are lifted up, amplified, more resources go into their schools. We've seen that time and time again when we are in front of school boards. And policy is much more informed from their perspective. So I'm in agreement that our young students, our students in general, are the best advocates for our community. We just have to ensure that we're always providing a platform for them and that we respect their perspective.
Dr. Theodore?
Just very briefly, that's a great question. And just to remember that the things that you learn in a technical education have to be married with a sort of a social understanding, a community-based understanding as well. When those two things come together, you understand an intracellular pathway, but you understand also where the patient lives and spends their time. When that kind of social understanding comes together with a technical understanding, you can make remarkable changes in this world, and we'll be looking for you.
I love that.
Dr. Lewis, 30 years at USC. I think you might know a thing or two about the young people's role.
So I want to start by saying that for the last 3 years, we've hosted on campus this kind of youth summit. In the this March, we had about 300, well, actually 200 people, let me be honest. But those are kind of youth advisory boards that are connected to LA City, LA County, Long Beach. They have youth advisory boards, and some of the other agencies have youth advisory boards, and that is what they do. They basically take youth issues and elevate them to those different bodies. And so to recognize that you, no matter how old you are or how young you are, you have agency. Mm-hmm. You have the right to have an opinion. You have a right to mobilize other people around that agenda and that opinion. And I would say, one of the things I would say to, at this point in my 30 years career, is that you do not have to ask permission to do what you think needs to be done. You just have to be willing to put in the effort, the time. It may take time, but the bottom line is we're past the point of having to ask for permission for what we think is relevant, what we think is our definition of success, what we think needs to happen for our communities. I just say run with it. Again, it's like don't ask permission because it may not come, and so just do what you need to do.
Melissa.
Dominique, thank you so much. Thank you, panelists. That discussion was so insightful. We learned a lot of information. And Khalil, hopefully we answered your question for you. Dorsey, hi in the house. You guys, we have more to come, but we're going to take a 5-minute break. We've got more discussions on the backside of this. So come back and